It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
Hey, Lise, how are you?
Hey, Dr. T. I'm good. Thanks so much for having me here, inviting me to interrupt you.
It's my pleasure. I mean, this
nice.
is our first one, right?
It is.
We should jump right into it. A lot going on these days.
You know, it's been a busy time. A lot of anxiety building up around us.
Actually,
we're hoping you can help us with that today, I think.
Yeah, we need to stay calm. No doubt about that. And does that mean that we shouldn't learn about what's going on and see what we need to do? No, we need to be diligent.
That's right. I always think with knowledge, we can decide what it is we should actually be worried about.
And act rationally.
That's right.
So no, mall toilet paper crowds and people crowding in spaces. It doesn't make any sense. So what do you want to know about it?
What I think I'd like to know is, what should I really be worried about? I mean, is buying bottled water make any sense? Is our tap water going to be affected? I'm not sure about that purchasing decision.
Yeah, I mean, definitely people are treating it as if it's the end of the world, and it's definitely not the end of the world. But it is going to have some long-lasting impact in the short term and in the long term. I think you'll see changes in the way humans behave, and for now, we need to act rationally and think about the ways to prevent this pandemic from costing us from a health perspective. We already know that it's going to cost us from a socioeconomic perspective and even some down to an interpersonal perspective in some cases. And it's really shifting the human psychology right now. So, your question is, why should we be so afraid of coronavirus? Because if it goes unchecked and if we don't really practice social isolation and contain its spread, then it's going to have a huge impact on the health of our population. But is it, time to act against recommendations? And like I said, masses hoard onto Costco to buy paper towels and toilet paper and Lysol wipes just to expose themselves more? No, that makes no sense.
Right. I mean, I was at Costco. I'm going to be perfectly transparent about that. But there was no toilet paper left. So I feel like I'm outside of that hoard mentality.
You won't go back, right? At least not for,
I stocked up. I'm fine with it.
So, as of now, our recommendations at the clinic is to keep all non-essential visits out of the clinic. And we're shifting a lot towards telemedicine, phone calls, phone consults, a lot more emailing and faxing going back and forth. And at the same time, we're putting measures in so that when a patient does absolutely need to come into the clinic, that we practice what are called contact and droplet precautions. I encourage everybody to look up those terms, contact and droplet precautions.
While we're looking them up, though, do you want to give us a sneak preview about what they mean?
Yeah, sure. It has something to do with the way that the coronavirus is spread. And one of the silver linings is that we don't believe it's an airborne disease, meaning that it can't migrate several feet or meters in the air and infect other people nearby. We believe that it's more of a contact transmission, whereby you pass it on through a cough or a sneeze, or you touch the surface where the virus is laying dormant, and then touch your face or rub your eyes. And obviously, whenever something's contact, that's when we're referring to the surfaces. So it basically boils down to a lot of hand washing, not getting too close to people, not congregating. That's why you can see the sweeping recommendations against travel across borders. Cruise ships are now basically docked and no end in sight. I think it's the end of the handshake as we know it. I think people will be stretching if they fist pump for a while, and you're going to see a lot more elbow taps. Even human congregations, that things like religious ceremonies are going to be affected. And it's important to clean and disinfect our environments, but by no means should we be acting in hysteria and hoarding. We need to take these measures as a society and prevent the government from having to impose them on us. We're hearing horrific accounts out of China about the way they had to quarantine their population in what some people would consider cruel ways. And the numbers this week are showing that it may have actually been quite effective at stemming the spread. So here in our free society and our free culture, Canada, we need to use our intellect and our rational thought and act in a way together to prevent the spread. And if we do so, we could be quite successful at least keeping it under the wraps a little bit.
I think also, and on top of saying intellect and rational thought, it's important to consider our social conscience and using that
Absolutely.
to move us forward. So I think it's good to look at that as our silver lining and saying that people who are healthy and maybe aren't as worried about becoming ill are also most of the time taking those precautions as well.
Well, let's not take it. I mean, it's definitely not our elderly who are able to stand in line at the supermarket and hoard items. So, if we're hoarding, we're taking away from our most vulnerable population. And really, they are, when it comes to COVID-19, once you're over the age of 70 and you catch the disease, your mortality rate jumps up significantly, and even more so when you're 80 or above. So we need to take care of our vulnerable population, and it's like you said, it's about a social conscience. What do I need to do to take care of myself and yet take care of my fellow citizens, fellow family, friends, wider social network? So we need to act as a unit, and that's the only way we can overcome something like a natural pandemic and a true natural threat bigger than us.
That's right. And I also would like to point out that it's often people that have resources that can do the most good in terms of their social conscience. There are people out there who simply cannot stay home from work because they literally won't be able to feed their children or pay their rent if they do that. They don't have a position where they can work from home. So those of us who can should.
Absolutely. I mean, I think, you're alluding to the economic impact that this is going to have. And it's extremely concerning. And one of the reasons why is because what we're going to see is we're going to see both a supply shock and a demand shock. So, obviously the supply chains around the world have been severely disrupted. And so the refinement of products and manufacturing and distribution is going to take a huge hit. And from the demand side, as people self-isolate and quarantine and see their losses on the stock markets, you have to remember these are the worst losses on the Dow Jones since 1987 in terms of single day percentage losses that we're seeing. It has brought the global travel industry to its knees. COVID-19 has shut down sports leagues. NCAA March Madness has been canceled. The next 3 UFC events have been canceled. The entire northern region of Italy, they're running out of ventilators and deciding who gets one based on who has the highest chance of surviving. So, and we're behind the curve. We have the Atlantic Ocean and the Pacific Ocean, and it serves as a buffer, but we're just now starting to get into the healthcare costs. And, the government has definitely acted swiftly and implemented some policies to help support us economically. But, I anticipate that this is going to have economic impacts that last for a long time, the same way that the financial crisis of 2008 still has an impact to today. I mean, we see that with the perennially low interest rates, the lowest they've ever been in human history since we started recording them 4,000 years ago, believe it or not.
I find it interesting that we started recording interest rates 4,000 years ago.
Yes, we did. That's, that's very interesting, actually.
What I'm wondering is, you mentioned your clinic and how you're sort of delivering care in a really different way. How are your patients reacting to that?
I think overall the patients understand the gravity of the situation and recognize that we need to pivot. Actually, I give our patients a lot of credit for the way that they have been self-isolating and following the instructions that they're getting from public health authorities and from healthcare practitioners. But it has actually been going quite well. And because of that, I anticipate that we may actually see some long-lasting change in terms of the way we deliver and practice medicine moving forward to a more remote-based system. But we have to find the balance, because at the end of the day, the physical exam is a very, very powerful piece of the diagnostic puzzle. And it's not always necessary, but in certain situations, it's indispensable. So whether you can do a physical exam that will suffice over video conferencing is one thing, but certainly there'll be moments where you're going to have the patients come in. But we need to start rethinking waiting rooms and the way we have sick patients sitting in congregates outside of the triage area. I think we're going to start to bill in a way and reimburse practitioners in a way whereby they can do things a little bit more remotely. And I think patients will also quite possibly, especially the new generation, become a lot more open to the idea of not having to have a physical visit every time. So we'll see. I mean, there's a lot of uncertainty, and that's something that I want to get into in one of our future podcasts. And get a little bit more philosophical after we've kind of defined what's going on a bit more. But, just uncertainty and how that affects us as humans and how we deal and cope with uncertainty. So it's going to be very interesting how things unfold.
Well, that's right. I mean, there's one thing that can be said for certain right now, and that's that every single habit we have, almost, is changing, and it's changing really rapidly. So it'll be interesting to see what sticks.
Well, tell me, how have your habits changed? I want to hear as your doctor for the next 30 seconds, 60 seconds.
Oh, thank you.
Yeah, what are you doing? What are you doing?
I've worked really hard for this degree.
Yeah.
Well, first of all, I have an amazing handshake. Okay, and I do business meetings all the time, and my handshake gets me indoors. So, it's really interesting now to have to sort of say, I would shake your hand. I'd love to shake your hand, but I think we should respect the greater situation right now and work within it.
So what is it, like one of those NBA handshakes that they do on the sideline where you do?
Maybe one day you'll be able to find out. Right now, I can't share it with you. I'm so sorry.
It looks like we have some work to do. We have to come up with a handshake. Yeah, no, I am not shaking the hands of my patients over the past 1 week, which is, it's something I never thought would happen. It's one of the first things they taught us during our clinicals in med school. They said, when you walk in the room, build rapport and shake their hand. Well, now we're doing either a fist bump or we're doing elbow taps or namaste. It's going to be interesting. But people, like they said, just going back to the question you asked, they understand. And people aren't reaching out for the handshake. I think it's the end of the handshake for as long as we're around. I think we'll see. I could be wrong.
We'll see my handshake in the Handshake Museum one day, and that'll be the end of it.
That's right. So even human behavior becomes dated.
Right.
So,
I think we've all noticed how much we touch our faces constantly, which is new.
Yeah, absolutely. People are going to be more conscientious of that. For sure.
I'm glad it's a podcast, so nobody can judge me for how many times I've touched my face as I'm speaking right now.
I haven't seen you do it once. Not once.
Well, thank you.
What else? What else is going on with this COVID-19? I think it's important before we wrap up here. I just want to define a couple of terms here, and this will lead into our next podcast as well. Okay. So what is an epidemic? All right. An epidemic is the rapid transmission of a disease to large numbers of people in a short period of time. And what's a pandemic? A pandemic is a widespread epidemic, for example, a global epidemic. Thus, we call it a pandemic.
A pandemic crosses borders. An epidemic doesn't necessarily. Is that?
That is correct. An epidemic is contained within a geographical area. But I think we'll get more into the current pandemic and the effect it's having as we continue this wonderful mini-series. It's very exciting. Our inaugural episode.
Mm-hmm. I think everyone should stay tuned. We've got lots of content and lots of good information coming your way.
So remember, everybody, stay safe, self-isolate. It's March 18th, 2020. We're looking for a mass social isolation for the next few to several weeks. Wash your hands, keep your loved ones safe, especially our elderly. And we'll see you soon.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.